Evening, everyone. Welcome to New Canaan Library. My name is Heather Semino. I work in the Adult Programs Department here at the library. So tonight, the library and Stamford Health have teamed together to bring you a special program about sleep. And we're going to learn about the functions of sleep, how sleep changes with age, that's me, sleep apnea, insomnia, sleep deprivation. But then on the flip side, what can we do to improve our sleep? So I think that's important too. Our speaker is Dr. Dominic Roca, the medical director of sleep medicine at Stamford Health. In addition to being an MD, he has his PhD in neuropharmacology. He has expertise in allergy, immunology, pulmonary, critical care, and most importantly for tonight, sleep. We'd like to introduce Dr. Roca.
So much of our life is spent sleeping. Approximately a third of our life is spent sleeping. And yet there's a lot of misunderstanding and unknowns about why we need to sleep. One of the biggest topics these days is basically these last few things here, which is if you deprive people of specifically REM sleep, which is dream sleep, you don't learn as well. If you have less sleep, you don't remember items as well. And the newest discovery is about a chemical called adenosine. And as we think and as we learn during the day, we build up adenosine in our spinal fluid and the fluid around our brain. Adenosine makes you sleepy. What blocks adenosine? Caffeine. And so when you sleep then, your body gets rid of the adenosine and then the whole day starts. So adenosine is turning out to be a big factor in why we get sleepy during the course of the day. As you might imagine, therefore, if you lose sleep, your learning becomes impaired, well-being becomes impaired, your immune system gets impacted, glucose control gets impacted. Vaccine efficacy actually gets impacted. There are a lot of different aspects of sleep, and it impacts a lot of our function. How much sleep do we need? Adults need on average 8 hours. There is a misunderstanding that as we age, we may need less sleep. That's not true. We need the same amount. Unfortunately, as we age, different things happen to our bodies. Our back hurts, our shoulder hurts, our sleep becomes lighter. So your sleep becomes more fragmented and you end up functioning sometimes with less sleep, but you don't necessarily need less sleep. What happens as we get older? Our sleep becomes lighter. As a result of that, you tend to get more sleepy during the day and you may need to take a nap. And unfortunately, that is just as we age. If you look at the amount of deep sleep that we get, if you're looking at deep sleep here, you'll see as we age, deep sleep becomes less and less. Light sleep increases, and interestingly, REM sleep, which is not deep sleep, stays fairly constant once you've reached adulthood. I'm just going to take a moment here. If anybody has some basic science questions about sleep, I'm happy to answer those basic science questions. Otherwise, we'll start getting into more clinical topics. It's about the basic science of sleep. The first topic I'm going to talk about is sleep apnea. So what is sleep apnea? You see here is air is going into our nose, into the back of the throat, and into the lungs. It's passing by adenoids, the roof of the mouth, tonsils, and the tongue, and also the sides of the throat. And what you see is that in sleep apnea, airway becomes more narrow. So now we're working harder to breathe. So what does sleep apnea look like? So basically it looks something like this. Or it looks like that. The issue about sleep apnea is most people who come into the sleep lab don't know they have sleep apnea. It's the person sleeping next to them that knows. And every time when you have a couple come in, you ask the person why you here. I don't know. She made me come here. She says that I snore. Do you snore? No, I don't snore. She snores. I don't snore. And that's typically the way the conversation goes. Occasionally we'll have people come in and say, you know what, I wake up and I'm really tired. I feel tired in the afternoon. I'm sort of struggling to stay awake. But most of the time, people are coming in because their spouse is saying, you snore really loud, your breathing sounds irregular, or your heart doctor said, you know what, I'm worried about you. Your blood pressure is high, you have some irregular heart rhythms, your neck is a little bit big, I want you to see a cardiologist, sleep doctor. Because sleep apnea is associated, when you have sleep apnea, you're working and you're working hard to breathe at night, it's a stress on the heart. It's making the heart have to work harder at night. And so there is a twofold greater risk of stroke, twofold greater risk of potentially cardiac death, as well as an increase in arrhythmias, particularly atrial fibrillation. This is, again, the association of sleep apnea with high blood pressure, which is HTN, hypertension, arrhythmias, stroke, and an increased risk of mortality. When you do a sleep test, you can do a sleep test in the hospital, but most of the time now, 80% of the time, we're doing a sleep test at home. And it's a small cannula that goes underneath your nose, a little strap around your chest, and something on your finger. And from that, we can typically diagnose sleep apnea. And how do we treat it? Well, we can use a dental appliance, something that pulls your lower jaw, you put it in your mouth. You can wear a device that keeps you off of your back, or you can do surgery. And the surgery that's typically done these days is called Inspire. You may have seen commercials. And there is a device that goes embedded under your skin. It stimulates your tongue muscle. By making your tongue muscle come out a little bit, it opens up your airway. And then something that most people have heard about is CPAP. And that's a device that goes over your nose generally or under your nose and applies pressure to the back of your throat to open things up. Weight loss helps dramatically. In the past, that was commonly done with surgery. Now, with the medications like Ozempic, we have been able to successfully treat a lot of people's sleep apnea just by having them lose weight. So again, sleep apnea is very common. Most people are not aware that they have a problem. If you snore regularly and you're waking up tired, then there's a very good chance you may have sleep apnea. Anybody have questions about sleep apnea? There's different devices, and each device has sort of different setups. Most of them are just one night. But you raise a good question. If you're not sleeping that night, then it's not going to detect it. So we always ask the patient a question when they deliver the device back in the morning: did you have a typical sleep? And if they did not, we have them do the test over again. Or we tell them to call us if they've had a particularly unusual night and to repeat the test. Unfortunately, there is nothing as successful as the CPAP mask. CPAP basically is a guarantee. If you wear it, it'll work. The surgery is about 60% as effective as the mask. But when you take into consideration that not everybody who gets the CPAP wears it all night, if they wear it, say, 5 hours a night, then that means maybe 2 to 3 hours a night they're not wearing anything, and you balance that out, it's better than nothing for sure. But in general, if you wear CPAP all night, it's going to bring you down to a normal level of breathing, whereas Inspire will improve your sleep apnea by about 60%. So sleep apnea generally stays about the same unless you gain or lose a significant amount of weight, or God forbid you have a stroke. There is some increase in sleep apnea, but it tends to be mild as we age. There is some changes. We just tend to get a little less tight, and so that can contribute to a worsening of sleep apnea. But really, if your weight stays stable, your sleep apnea doesn't change. The best way of doing it and the cheapest way of doing that is if you're married, you ask your spouse if you still snore. If you no longer snore, then the likelihood is you no longer have sleep apnea. But if you really wanted to make sure, let's say you have a cardiac arrhythmia, your cardiologist wants, then you would need to do a home sleep test to be positive. If you have a glass of wine one night and you don't have it another night, there could be a significant difference in your degree of your sleep apnea. Anything that relaxes you will increase the likelihood of you having sleep apnea. If you have a viral infection, you're going to have more sleep apnea. If particularly you injure your shoulder and you have to spend more time on your back than typically you sleep on your side, that's going to worsen sleep apnea. So yes, sleep apnea can vary about 10%, 10-15% from night to night easily. There are some patients who have sleep apnea almost exclusively on their back. They go on their side, they don't have sleep apnea. But in general, it's better when you sleep on your side. It's less severe when you sleep on your side. But usually people will still have some residual sleep apnea on their side. So again, as was asked before, if your spouse says, hey, you're not snoring anymore, and you wake up feeling refreshed, you probably don't need to do a sleep test. But if there's reported snoring, if you're still waking up sleepy, Or if it's you live alone, then doing a sleep study is a reasonable thing to do. And again, as I mentioned before, if you're someone who has particularly atrial fibrillation or difficult to control hypertension, it might be a good idea to repeat the study so you know for sure.
Do you recommend antihistamines as symptomatic relief?
For sleep apnea?
Yeah.
So, not in general, no. Years ago, they would focus in on the nose and they would actually do surgery on the nose to try to improve. But if you think about it, if my nose is completely clogged and this is the source of my problem, then all I have to do is open my mouth and the problem's gone. So the problem typically doesn't go away because the problem tends to be in the back of your throat. So in general, treating the nose doesn't typically make a big difference. There are some exceptions, but typically not. I'll move on to the next topic. So we'll talk about a little bit about insomnia. So what is insomnia? And people will separate them out. You know, I have trouble falling asleep, I have trouble staying asleep, I have both. In general, we think about them as all one thing. But there has to be a consequence of it. If you're going to bed at 12, you're getting up at 6:30, and you feel great, and you're not dozing off, then you are a lucky person and don't need as much sleep. So it's not the amount of time that you sleep, it's how you feel the next day is a bigger factor. Now, if you're wide awake and you're drinking 6 cups of coffee, well then that's not really fair. You're cheating. So how does insomnia start? And this is true, it's fascinating, it's true for almost every patient who has insomnia. There's a component of this, and that is you have a genetic predisposing factors. You tend to be a lighter sleeper. Then a stressor occurs, and that changes things. There's an illness in the family, and that's keeping you awake. That stressor goes away, but along the way, when that stressor occurred, you start developing bad habits, such as you're so tired you go to bed early, or maybe you feel so tired today you're drinking extra caffeine, or you've begun to psych yourself out that when you wake up in the middle of the night, you're not going to go back to sleep. So now it's gotten into your head. If any of you play any sports, you know that a lot of it is just muscle memory and just going through. If you start thinking about it, you fail. And that's what happens with sleep. You can't force yourself to sleep. You can force yourself to eat right, you can force yourself to exercise, you can force yourself to meditate, all these different things, but you cannot force yourself to sleep. And the minute you're trying to force yourself to sleep, now you're in trouble. And so after everything is done, you still end up with the insomnia because now it's gotten into your head. So this is a typical situation where a person may sleep for a couple of hours, then they wake up, they go back to sleep, then they wake up, and then maybe the rest of the night they're sort of on and off. And almost all the time when people have insomnia, the person that they live with or sleep with doesn't. And so they want to kill the other person because they're sleeping so well. So it becomes this sort of nightmare, and you're just thinking about going to bed for some people becomes anxiety provoking. Like, here's going to be another night where I can't sleep. Or you wake up in the middle of the night and it's like, damn it, here it goes again. So how do we correct the problem? It's a combination of things. We change your habits at sleep hygiene. We try to get you to spend less time in bed, to learn to associate the bed with sleep. So the sleep hygiene, I'm going to skip this because most of it is self-explanatory. And this is really the crux of it. And it sort of goes against what people think sometimes, is you really want to do only one thing in bed, is sleep. You don't want to read. You don't want to watch TV. You don't want to listen to music, because you want to train your brain that bed equals sleep. Now, that doesn't mean forever, but while you're going through therapy and while we're trying to work with you to get you to sleep better, we ask that you don't do anything else in bed except for sleep and intimate activities. Because again, you want to train your brain, just like Pavlov's dog, you want to train your brain that bed equals sleep. So only thing you do in bed is sleep. And the other thing we really push is sleep restriction. If you are a great sleeper and you injure your leg and you're in traction, so now you're in bed for 24 hours a day, except for perhaps bathroom breaks, you could have been the best sleeper in the world, but you're no longer going to sleep well. Because there are going to be times in the evening you're going to doze off. There may be times in the morning where you doze off. And then as a result, your sleep drive, your body's desire to sleep, is not going to be as strong. And so when the nighttime comes, it's going to be a little bit harder for you to fall asleep. When you wake up in the middle of the night, and we all wake up in the middle of the night several times, you are not going to easily go back to sleep. Because when you wake up, you're going to be like, damn it, now I'm not going to be able to sleep. So less time in bed, confining your time in bed to sleep and nothing else is critical. Now, in the sleep center, we don't really have time to go through cognitive behavioral therapy. But what essentially is in this is that you want to put things in perspective. You've been able to function at a relatively high level despite not sleeping. There's no data showing that, okay, if you have insomnia and you can't sleep, that by sleeping less, you're going to die earlier, something bad's going to happen. There's all this associative data. They look at studies and say, oh, patients who don't get enough sleep, they have a higher risk of problems. But you're putting a whole bunch of different people into that category. People who might be out partying, people who may work 2 or 3 jobs. Their body can sleep, but they're not letting it sleep. That's a very different situation than you're having trouble sleeping. So basically, we tell people to spend less time in bed, avoid time in bed awake, and that's mainly the key thing. And so insomnia is a very common problem. Approximately 30% of people will have insomnia at some point in their life. We argue that you should spend less time in bed and spend time when you are in bed, that time is spent sleeping. Anybody have questions about insomnia?
Would you think it okay to read as you were in bed before you fall asleep?
So what I always tell people, because invariably there's discussions like this, people say, well, I have a shot of vodka and some hot milk before going to bed at night, and I've been doing it for 20 years. I'm like, God bless you, you've been doing it that long. But if you're having trouble sleeping, then you have to make some changes. So if you're someone that gets into bed at, 11 o'clock, 11:30 at night, and you read for half an hour, you put the book down, you fall asleep, and you sleep well through the night, you don't need to make any changes. But if you're coming to me and you're doing that, and your response to me is, well, I've been doing this for years, they'll say, well, now it's not working, so you got to change something up. So in general, if you're sleeping well, you can do whatever you want. My dad used to have a cup of espresso, and then go to bed, whatever, and he slept. So if it works, fine. Any other questions about insomnia? Yes?
How long does it typically take for a person to change their sleep behaviors?
It depends. There are some people that are very disciplined and can adapt to it within a week. And then there are other people who can take 2 or 3 weeks. And then there is a group of people, maybe 10, 15% of people, who never get it. That when they try to restrict their time in bed, they just become too anxious, and that anxiety overwhelms everything. And I've had patients where from the moment they get up, they're worried about their sleep at night. And when you get to that kind of anxiety, then you need something else. Just talking to someone and behavioral therapy may not work, and you may need medication. People are always worried about taking medication, and I agree. You want to get by with as little medication as possible. But if you're talking about a situation where you take a medication at night and it helps you feel much better during the day, and you're using the lowest dose possible, then I'd say it's worth it. Doesn't mean you have to take it forever. Maybe after a year, or you try to come off of it and you use a lower dose. But I think in medicine, and you guys have learned this over the years, there's always pros and cons to almost everything. You take a blood pressure medication, it may make you feel more lethargic. You take a steroid, it may make you more anxious, and you weigh it. So for some people, a sleeping pill may be worth it. Did that answer your question? Maybe. Okay, so I'm going to talk to you briefly about sleep deprivation. And then I'm going to talk about caffeine, naps. So how much sleep do we get? This is old data, although it's not very different now. On average, people need to sleep around 7 to 8 hours. The average person in the United States sleeps about 7 hours, so the average person in the United States is sleep deprived. This was a great study that was done quite a few years ago, and what they did is they took patients, these were college patients, and what they did was they did a study where they looked at people who took alcohol versus no alcohol versus sleeping for only 5 to 6 hours versus not sleeping overnight. And they did driving tests on them. And what they found is that depending on the sleep situation, you could be sleepy enough that it equals being drunk. So, and again, you can imagine if your alcohol level is just at the toxicity level, that may not be as bad as someone who's awake all night long. Whereas someone who's, could barely stand, they're going to be more dangerous than someone who's maybe only slept 6 hours. But clearly, there is an alteration in reaction time, there's an alteration in perception, and that can happen with sleep deprivation and in alcohol. And the scary thing about sleepy driving is that most people don't recognize how sleepy they are, and they do things like chewing gum or listening to the radio, and none of those things work really well. The only thing that works well in those situations is pulling over, having a cup of coffee, or what I always tell everybody if they tend to have long drives is put one of those 5-hour energy drinks in your car. You put it in the glove compartment, and you don't have to drink the whole thing because then your heart rate is going to be pounding. But you could take a sip of it, and that may help you. And in some situations, you really don't have much place to pull over. And so that's sort of a safety device that I sort of recommend. So caffeine, how does caffeine work? We talked about adenosine building up as we are functioning during the day and as we're working during the day. And sometimes as we get older, we don't have the power to read and study as intensely for a longer period of time. Whether that's because our body doesn't take up the adenosine as well, or we produce more, we don't know, but that is a factor of aging. So how does caffeine work? So caffeine blocks adenosine. It increases metabolism. It also helps you breathe a little bit better. So the good is that it helps you stay awake. It increases sense of energy, helps you to burn fat, opens up your airway. The bad is you can develop a tolerance. For those people who drink coffee every morning, if you could think back 40 years ago when you first had coffee, you'd be like, wow, boom, I feel great. But then what begins to happen over time is your body gets used to it. So now when you wake up, you can't function until you have the cup of coffee. So no longer is caffeine helping you become more active, it's getting you to normal. So a tolerance develops to caffeine. In addition to that, it can cause palpitations, anxiety, it can raise blood pressure and heart rate. So what I always try to recommend to people is caffeine's a great drug, but it is a drug, and you should try to use it selectively. Try not to use it every day. Try to be careful of how you use it. Just because most people are drinking a cup of coffee doesn't mean you have to drink a cup. Maybe you drink only a third of it, and that's enough to get you the effects that you want. It's a drug. You should use it as a drug. Use as little as possible, and then it becomes effective. I have to say, one of my children, he works in the city, and I grew up with never drinking coffee or any caffeine-containing beverages, and I said, look, there's going to be times when you need it, and there's sometimes he has to work overnight, and he'll drink part of a 5-hour energy drink, and it works because he's not used to drinking caffeine. Naps. Naps are a great thing if you use them selectively. If you are sleep deprived, and let's say I have to do something at 2 o'clock in the afternoon, it's something where I'm going to need my attention, then you want to take a short nap soon before that event, a little bit before that event. So this way it'll give you some energy and help your cognitive function. If, however, you're going to be up until, say, 1 o'clock or 2 o'clock, then you'll take a longer nap. Now, the problem with the longer naps is when you wake up from a longer nap, you're going to be groggy. So when you take naps, you have to be selective. If you're going for the long term, you want to be awake for several hours afterwards, then being groggy for an hour or two is not that big a deal. You're willing to take that in order to get this benefit. But if you want to get benefit for a short period of time, an hour or so, then those short naps work better. Because if you start taking a longer nap, you tend to get into deep sleep, and that's the sleep when you wake up and you're like, what day is it? Where am I? So you want to try to avoid going into deep sleep if you need to be awake and alert soon after that nap. Does that make sense? Basically, this was a study where they looked at naps and how well it helped you in performance. And again, short naps were great for something right away, long naps for something long term. So tips for sleep-deprived people. If you're working, you have a deadline and you're really crunching it for a week, then getting naps and sleeping whenever you can is the better way of doing it. Sleeping more on weekends are going to help you feel better on Monday. So try to get sleep whenever you can. Is it as good as perhaps sleeping 8 hours? No, but it's certainly better than trying to force your way through the course of an 18-hour day. Take a nap. You have an opportunity. There's a lull. Take a nap. If you're not a morning person and it's hard for you to get up, it's better to sleep later on the weekends than it is to say, well, I have to get up. I have to make the weekend functional, because you're depriving yourself of something your body really needs. So try to take advantage of opportunities when they come up and take those naps, or sleep later when you can. So sleep deprivation, interesting, there's some great studies that it can cause weight gain. There's some wonderful studies at University of Chicago where they took a group of people, and one group, they made them sleep only like 5 hours, the other group 8 hours. And then they came to a breakfast layout, and the people who were sleep deprived tended to go for the sugary foods. And the people who slept well tended to be more judicious in what they were eating. The conclusion is, and it's teleological, is that your brain perceives sleep deprivation as lack of energy. And when you have sugar, there's this burst of energy that gets to your brain. But obviously, consequentially, it can result in weight gain. Caffeine can be helpful if used intelligently and only when needed. If you're really sleepy while driving, radio, window down, doesn't really work well. You really need to have sleep. And so one of the best ways is, I'll tell people to have a couple of sips or a sip of their 5-hour energy drink. If you can pull over safely, take a 15-minute nap, 20-minute nap. The caffeine will kick in after the nap is done, and you'll have the benefit of a short nap and the caffeine. And then one of the things I always, when I give lectures to the teenagers, is, everybody's being taught appropriately, don't drive drunk, but they should also be hesitant to get into the car of somebody who's been up all night studying, because it can be very dangerous as well. Okay, some general tips to improve sleep. Downtime before getting into bed. If you got a million things you're doing, you're working really hard, and you jump into bed, you might start thinking about all the stuff you just did. Give yourself some downtime. Give yourself some time to relax. And as I was telling this lady, one of the things that works better than watching TV is doing something that uses your brain but is not overly stimulating. Crossword puzzles, Sudoku, anything where you're using your brain but it's not necessarily overly stimulating. Avoiding caffeine and alcohol. Alcohol will help you fall asleep, but what happens is as the alcohol wears off, then your sleep becomes very fragmented. If those of you who have Fitbits or anything, have a night where you've had a couple of glasses of wine and look at your heart rate and look at how your sleep is versus a night when you don't. And you'll see in the beginning of the night you might sleep well, but then the rest of the night becomes fragmented. If you have insomnia, spend less time in bed. Even though you really want to get into bed because you feel tired, spend less time in bed. It will do you well in the long run. If you snore loudly, think about getting a sleep test. Regarding supplements, the problem with supplements is that since there's no large pharmaceutical company supporting them, they're not well regulated. You don't have large randomized controlled studies, and the FDA doesn't control the medications. So I'm sure some of them help, but we don't have good data. If you do buy a supplement, one thing I would recommend is get the ones with the label of USP, because that's a voluntary organization that subjects your product to analysis. And sleep until when? My answer to a lot of these questions will be the same, which is if you feel good the next morning, if you feel refreshed and you're not tired, that's fine. If we go back before electricity and before light, man would go to sleep when the sun would go down. And obviously that would tend to be too long. And historical records will talk about sort of an hour of lovemaking, because people would go to bed, then they would wake up in the middle of the night, and they would have relations with their spouse, and then they go back to sleep because they couldn't spend that whole time sleeping. So it is a natural thing if you spend a lot of time in bed to wake up in the middle of the night. And I mean, I'll tell you myself, when I'm working crazy hours, I typically don't drink coffee, but if I have to stay awake for an 18-hour day, I know that I'm not going to sleep well, and I'll have the situation that you're describing where I will wake up because I've had too much coffee, so I'll wake up like 3 hours after I've gone to sleep. And what I do is I get ready and I go to work, and then once I get to work, because I get there really early, then I'll sleep at work for an hour or two, and that works for me when I'm having tough schedules. So again, there's nothing that says if you fragment your sleep that something terrible is going to happen. If you feel good, I wouldn't worry too much about it. It's happening less now in the world, but there, as you know, there are entire cultures that have siestas, right? You would feel, and if you look at alertness over the course of the day, everyone has a dip at some point in the time, either like from 11 a.m. till about 3 p.m., there's a dip in alertness. So our bodies have a dip in our alertness, and it's a natural thing to want to take a nap for many people. Now, some people it's not as bad as others. Other people it's pretty profound. What I suggest to you is experiment, right? If you are finding that, hey, I can't function, I'm dragging, and you could take a half-hour nap and feel great, and then it doesn't impact your sleep at night, perfect. Now, if you take a nap for 3 hours, then obviously you're going to have trouble. And what is right for you is different. Everybody's different. The other thing to keep in mind, if you tend to take a longer nap, you're more likely to wake up feeling groggy. If the nap is shorter, you're less likely, because the longer the nap is, the greater the chances are you're going to get into deep sleep. And if you get into deep sleep, then it's a little bit harder to wake up. But I'm a big fan of naps, and in a lot of the high-tech places, they'll have nap rooms, right? So yeah, I'm a big fan of taking naps. So I don't think that taking a nap is necessarily a bad thing. And then you'll have, again, this is observational data, and observational data can be misleading, where they'll say, oh, those people who take naps and nap a lot during the day may have an increased likelihood of dementia. But those are observational studies, and unfortunately what happens in dementia is you tend to be more sedentary. And if you tend to be more sedentary, you doze off during the day. And if you tend to doze off during the day, you're not going to sleep well at night. And people will get up and they'll roam around at night because they can't sleep. So that's a different situation than someone who has high functioning and just wants to take a short nap. Yeah.
Can you comment on the use of a computer and the light or an iPad before you're going to sleep?
So many of the devices nowadays will vary the amount of blue light, and they have like a nighttime mode to sort of minimize blue light exposure. And so in general, it's not that big a deal. Obviously, if you're on your iPad and you're watching a murder mystery or something like that, then obviously it's going to keep you awake. But on the other hand, if you're analyzing, I don't know, I guess everybody's different. Some people get really excited analyzing some portfolios. But, tax law. I mean, there can't be many people that are going to be getting excited about tax law. But if you're doing something that's intense, that's requiring brain power, and you're using a pad that has been adjusted for nighttime viewing, I think it's fine.
But if you're using it and you're not using the nighttime mode,
Yes,
problem, right?
correct. Yeah.
I would add to your list of whatever was distractions or something, the darkness in the room. There's light in the room, it's hard to sleep, at least it is.
Yeah, so light is, there's a term called Zeitgeber. Zeitgeber is, as you might imagine, a German term that's sort of indicates the thing that controls our biological clock. And light is the strongest thing that controls our biological clock. So if I expose you to bright light in the evening over a period of about a week or two, you'll tend to want to go to sleep later. Conversely, if I make the place really dark early on and then give you bright light in the morning, you'll go to sleep earlier and get up earlier. And that is the way, like when I have patients who come to me, I have this one physician, anytime she goes on a long trip, she'll come and see me before, so we set up our schedule before she leaves for the trip so that she's not jet lagged too much. She doesn't care about being jet lagged when she comes back, but for the trip she wants to be right on. And so we'll change her schedule so that it's not as dramatic a change when she goes there. But light is a huge factor in how we adjust it. And the other thing that we'll sometimes do is use melatonin. Melatonin, people talk about melatonin being a sleeping pill. It's really a lousy sleeping pill if you take it right at bedtime. What we do is when we want to change someone's circadian rhythm, we want to help them fall asleep earlier, we'll give them melatonin about 4 hours before bedtime, about 3 milligrams, and that can sometimes work well. But as a sleeping pill for adults, it doesn't work great. The only studies that have shown efficacy of melatonin happens to be in autistic children, and they're using doses like 12 milligrams, so much higher doses.
I feel like I've always heard before, you should go to sleep at the same time every night, get up at the same time every morning, but you said don't go to sleep until you're sleeping.
Yeah.
You don't get sleeping until really late, and you're just sort of on a, like on a different time zone.
Right, so yeah, so there are people like that.
Is there a way to adjust that?
Yeah, so that's what I was talking about. So there are people, and teenagers are the most notorious for this, and I'll have teenagers come. If I see, a 17-year-old, 15-year-old, 20-year-old in the office who's thin, that's circadian rhythm. I don't even have to ask them any questions. Their tendency to go to bed around 2 o'clock, that's the time they fall asleep, and then on the weekends they sleep till like noon. So their circadian rhythm is off. And so what we do in them is we have them on Saturday and Sunday particularly, we make them get up early, the same time they're going to get up during the school week, and then we hit them with melatonin, about 3 milligrams at around 8 o'clock at night, and then we eventually give them bright light in the early morning. You can buy a light box, and we usually recommend it's about 10,000 lux. You put it in front of you while you're eating breakfast or for 15 minutes, 20 minutes, about a foot away, and that can help change your circadian rhythm. And so use that in the morning, melatonin at night, and that generally will get your biological clock in order. Yeah.
I have a question. If you go to sleep around midnight, wake up a couple hours later, stay in bed maybe half an hour, try and fall back to sleep again, you said get up, what would you do? Go read?
Oh, okay.
Or is that too stimulating?
So the question is how, again, you don't have to make any changes. If in that half an hour you're having pleasant thoughts, you're feeling nice and cozy, and you don't mind being up for half an hour, and then you wake up in the morning and you feel great. Now, if in that half an hour you're pissed off because you're awake, then you gotta make some changes. And so in that situation, I would go to bed a little bit later and get up a little bit earlier until you find you're falling asleep and sleeping through the night most of the night. Exception of bathroom breaks. You want to be able to go to the bathroom and then come back and go to sleep. So I would shorten the time in bed by about an hour. And then once you find you're falling asleep and staying asleep, then you could either add a little bit of time to the time you go to bed, or maybe sleep a little bit later. There's always a sweet spot, and everybody's sweet spot is different. Your sweet spot may be 7 hours in bed. Somebody's may be 6 hours and 45 minutes. Somebody may be 7.5 hours. You'll have to experiment a little bit and find out what that sweet spot is. In terms of going to bed, you had mentioned going to bed at the right time every night. Again, you don't want to go to bed if you're wide awake. If you're wide awake and you're going to lay there trying to sleep, what you're doing is reinforcing that the bed is a nightmare. That this sucks and I can't sleep, and why can't I sleep as well as he or she? And now I'm going to feel terrible the next day. You're just creating this vicious cycle of you're not going to sleep. So you really want to try to avoid that as much as possible. And if you're wide awake, and that's what happens with high school students. You have like the most diligent students who they come home, they've had sports, now they're studying, then they spend some time talking to their friends, and they're wired. And the mom and dad are saying, you got to go to bed at 10 o'clock. And they go to bed at 10 o'clock, and they're like, they're not going to sleep. And then they wake up at 6:30 to go to school, and they're dragging. So then on Saturday and Sunday, they sleep, till 1 o'clock. And then what ends up happening is, what I always explain to them is that you're like a California kid who came here, and so you're a California kid, you arrive on Monday, and you're supposed to get up at 6:30, which for you is like 3:30 in the morning, and you're dragging. But you can't sleep because your biological clock is not in sync. And so what ends up happening, maybe by Friday, you start to sort of get adjusted, but then you sleep late all day. And so you never really get in sync. So you just have to be a little more.
Can you talk about insurance or Medicare, how those insurance relates to sleep tests and those kinds of
So
stuff?
for sleep tests, I'm not an insurance expert, but for the most part, almost all insurances will cover a home sleep test. In fact, for many of the insurances, you don't even need to get prior authorizations. They'll allow you to get a home sleep test. A hospital test will oftentimes require prior auth. Now, just because the insurance is paying for it doesn't mean there's not a copay, there's not a deductible, blah, blah, blah. But for the most part, the sleep studies generally are not a problem. I would say 95, 97% of the time they're covered, with the exception of a deductible or a copay.
How accurate are these smartwatches that analyze the quality of sleep?
So it's an excellent question. And the American Academy of Sleep Medicine regularly tests these devices. The problem with these devices is that the algorithms are proprietary. So we don't know, they don't release how they did the studies, how they compared it. So all we have is we compare it to our sleep studies. And for the most part, there is a significant amount of correlation. The problem is in older people, it overestimates the amount of sleep you're getting, because almost all of the watches are based on one thing, and that is movement. It's an accelerometer that measures movement. And if you're moving, it assumes you're awake. If you're not moving, it assumes you're asleep. And so that's the problem. And for the most part, that's true, obviously. But there are people who can stay really still at night as they're trying to fall asleep. And there are other people who sleep and they can move a lot. So I would say, for the most part, you're talking about a correlation with an overnight sleep study in the hospital, about 85%. And there's also devices now that measure oxygen and devices that measure snoring. So there's some pretty good devices out there. The problem is that some people get so fixated on it, and they come into me and they say, I'm not sleeping well. And they show me this graph. And I'm like, well, how you doing? I'm doing great, but I'm terrible because look at my graph here. It's like, listen, I'm not giving you any drugs based on this test. You know, just chill out. So the problem, that's a big problem with it, is that there's so much we don't know about sleep. And while, yes, we know what a normal night's supposed to look like, but there's variations. And just because there's variations, like let's say you do a test and it shows you don't have much deep sleep. So, but if you feel good, what does that mean? The fact of the matter is when you get to be about 75 years old, there's only about 5% of your sleep is deep sleep. That's just unfortunately how it goes. And so, but the device doesn't care about that. It's like, oh, you're not getting deep sleep. And then people are like, oh, what do I got to do to take deep sleep? Should I take this med and this drug? No, if you're feeling well, that's the most important thing. The patient is the most important thing. The data is secondary, right? That's always the answer. Yeah, so that's what I was telling you. There's one doctor that comes to see me whenever she has these long trips. She will come to me and we'll look at the time zone that she's at and we'll move her time. So maybe it might, sometimes it's hard because people oftentimes work right up to the time they leave. But if they take a few days off before they leave, then we can really adjust their time zones by having them either start going to bed a little earlier every night and getting up earlier every day, or vice versa, going to bed later each night and then getting up a little bit later. In conjunction with being very, very calculating in terms of your sleep on the plane. When should you sleep on the plane? And sometimes for that situation, we'll use medication on the plane to help you sleep if that's what you need to do. Yes. And there are apps you can go online. There are apps that can help you, guide you. Some of them you have to pay for, but I think there's a few that are free that'll help you move your circadian rhythm along. And like I said, melatonin, like 3 or 4 hours beforehand, will help you fall asleep earlier, and light therapy will help you get up earlier. Light at night will help you go to sleep later. So those are some ways that we adjust things. But we do that all the time and sort of adjusting things for people who are going to be traveling because they want to make the most out of their trip, or they have a business trip and they really have to be on their game at the business trip. Fall is great, right? Fall is great. You get an hour more sleep. The big thing that has been talked about in politics is keeping daylight savings time in place permanently. In the field of sleep, we're not big fans of that because what ends up happening is that during the winter months, you're getting up and it's really dark. And that's not along with your circadian rhythm. So we're not big fans of that. In the fall, things are good. You're sleeping a little bit more. In the spring, obviously, there's a problem. And you could sort of adjust for that by you have to start getting up a little earlier, and then you'll be able to fall asleep earlier. Now, if you're someone who could always fall asleep earlier, that's fine. Just start going to sleep earlier, and then you'll be fine. It's a problem. There's data showing that there's a slight increased risk of motor vehicle accidents right around springtime, right at daylight. So it's a definite problem. But in the field of sleep, in the community of sleep science, we really are not in favor of using daylight saving times all year round. And that study has been done in the past. I think it was like in the 60s, and it failed. There's no harm to changing your circadian rhythm. When you have harm is when you have rotating schedules, or if, let's say, you're a nighttime worker. Now, the problem with nighttime workers is, yes, they'll be awake those days and then they sleep they'll be awake those nights and then sleep those days, but their circadian rhythm is never on. The circadian rhythm is always screwed up. When you have constantly altered circadian rhythms, long-term, there's data showing an increased risk of mortality and increased risk of cancer in those patients. There's a reason why you should get a differential if you're working nights. It's definitely a hazardous situation. So if you're changing your circadian rhythm and then you're staying with that change, no, it's not a problem whatsoever. If you're constantly altering your circadian rhythm, yeah, it's a problem. Some studies, I think somebody mentioned it here, about blue light. Blue light is the most alerting. One of the things that we recommend for moms is to have a red light in the baby's room. So when they're going in there, they're not being wide awake by the light. You have a little night light and it's red. That will not alter your circadian rhythm as much and be as alerting. So the color of the light does make a difference. Thank you very much.